Remember to subscribe and don't forget to hit the bell icon to never miss an update from First Cry Parenting.
Reasons for preterm labor and how it affects the pregnancy. Most pregnancies last full term, and babies are usually born between 39 and 40 weeks of pregnancy. However, there are chances of the labor beginning earlier than the completion of the period. Such premature labor usually happens before completing 37 weeks of pregnancy. This may lead to the baby being born prematurely, with its own challenges and health-related issues. What causes preterm labor? 1. Multiple babies. If a woman carries twins or triplets, the chances of premature labor are higher. 2. Vaginal infections. Vaginal infections and sexually transmitted diseases, STDs, may increase the chances of preterm labor. 3. High fever during pregnancy. If the pregnant woman is suffering from illnesses and diseases, which lead to a fever above 101 degrees, the woman may go into preterm labor. 4. Vaginal bleeding. Sometimes, vaginal bleeding may be the reason for preterm labor. Such kind of bleeding is usually observed post 20 weeks of being pregnant. 5. Previous abortions. If the woman has had more than one abortion before the current pregnancy, then the risk of preterm labor is higher in such cases. 6. Stress. Constant stress, anxiousness about work, family issues, or high-wired situations at home could push your body towards preterm labor. Signs and symptoms: lower backache, contractions, extreme cramping resembling menstrual cramps, unexpected vaginal discharge, symptoms of a typical onset of flu, nausea, vomiting, diarrhea, the body's refusal to consume liquids, light-colored bleeding from the vagina. What do contractions feel like? False contractions during pregnancy are called Braxton Hicks contractions. These contractions are mostly irregular without specific frequency and usually do not cause the cervix to open. When these contractions become frequent and can be nailed down to a frequency of happening between 10 to 12 minutes, these could indicate preterm labor. Treatment to prevent preterm labor. No medicines or surgeries can prevent labor from happening once it has begun. There are certain recommendations that your doctor might ask you to consider. What can you do to prevent premature labor? 1. Prenatal care. Prenatal care helps address any medical conditions and take a check of medicines you are on to ensure that you and your baby stay safe during pregnancy. 2. Influenza shot. Suffering from flu during pregnancy increases your chances of preterm labor. Hence, it is best to get a flu shot as an active preventive measure. 3. Quit smoking. If you smoke, it's time to quit it. Opt for nicotine patches, although not ideal, or other ways to wean away from cigarettes. 4. Manage your weight. Obesity is a strong cause of triggering preterm labor. Maintain a healthy balanced diet and continue with light exercises and movements as much as possible. What impact does premature labor have on pregnancy? Premature labor does not always mean that delivery will be premature. If it does happen, such babies are at risk from physical and mental health complications now and later in life. Babies born in less than 24 weeks of pregnancy have a 50-50 chance of survival. Preterm labor management is absolutely necessary to mitigate the chances of premature delivery without causing harm to the child or the mother. Don't hesitate to get in touch with your doctor for more concerns or doubts.